Thank you for choosing me and my team for your knee replacement surgery at either Franciscan Hospital or OrthoIndy Surgical Center. This guide is intended to answer common questions and set appropriate expectations both before and after surgery, as well as information about the surgery itself. Please note that the individual risk and outcomes do vary, so this guide is intended to set the average range of expectations, but please be aware that variations are always possible. Usually the first series of questions is regarding the hospital stay, recovery time frame, and aftercare for planning purposes. The surgery itself is typically outpatient, which means that you will arrive and discharge home the same day. You will receive physical therapy and recovery, where you will be given guidance on navigating steps, utilizing a walker, among other activities. Some patients will stay overnight, either for medical monitoring or for rehab purposes. To go home the same or next day, we recommend a spouse, friend, or family member stay with you 24/7 for 3 days minimum and preferably 1 to 2 weeks, depending on your baseline functional status and anticipated needs. We also recommend bathroom and bedroom maintained on your floor level to avoid stairs the first 2 weeks, although using stairs is possible with a good railing and assistance. Inpatient rehab or skilled nursing at a nursing home is an option facilitated by the case management team after surgery at Franciscan Hospital, but this is the exception offered to individuals who live either alone or have assistance needs due to advanced age or medical comorbidities. Home healthcare physical therapy can also be arranged to come out twice a week for the first 2 weeks and is facilitated by Franciscan Case Management again after surgery for those who either may have difficulty getting rides or live a long ways from physical therapy. On average, the initial recovery is the first 2 weeks where you will be utilizing a walker, avoid driving, taking pain medications as needed, and then transition to a cane after 2 weeks usually. Most people are 90% recovered in approximately 2 months. You may still experience lateral knee numbness or burning, muscle spasms or soreness, and bursitis, which can also be managed with injections, continued physical therapy, but usually improves either way over time. Physical therapy is prescribed 1 time prior to surgery for pre-op exercises and then twice weekly for 6 to 12 weeks postoperatively by default. The physical therapist will discharge you when your rehab goals have been met. Patients normally return to work generally in 3 weeks for an office-type job, 6 weeks for a medium activity job, and 3 months for a highly physical occupation, such as working in maintenance or construction. Typically, we prescribe a pain medication, anti-inflammatory, muscle relaxer, aspirin, stool softener, and in some cases, an antibiotic to manage your pain and risk factors with surgery for the first 30 days. Icing for 20 minutes every several hours the first 1 to 2 weeks is very helpful. Place a cloth or other material between the ice and your skin to avoid ice burn. Some people choose to purchase or rent an ice pack sleeve or cooling machine, and Amazon provides an excellent option in this regard. You can shower immediately after surgery with the surgical dressing on, which usually stays on for the first week after surgery, and continue showering but no bathing or soaking for 6 weeks after surgery. Now that we've covered the most pertinent questions for planning and mental preparation for surgery, let's cover the procedure itself, risk and benefits. A total knee replacement involves replacing both the upper and lower joint surfaces with a metal cap, integrated with a plastic insert, polyethylene, and also a polyethylene insert on the back of your kneecap. This restores the lost cartilage in your joint surfaces. However, all your peripheral tissues are maintained around your joint. In specific cases, we may perform a partial knee replacement based on localized arthritis, which still involves metal caps and polyethylene specifically designed for a single joint compartment. I utilize both navigation and the Mako robotic system to facilitate precision and improved outcomes on pain, alignment, range of motion, and function with your surgery. Both navigation and robotics demonstrate superior results over manual instrumentation techniques. Robotics in particular is critical for alignment when performing a partial knee replacement. The risk of total knee replacement or partial replacement surgery include infection, bleeding, blood clots, of course scar and stiffness, swelling, fracture, implant loosening or failure, numbness and nerve pain in the lateral knee, and in exceedingly rare cases, loss of life or limb from heart, vascular, or blood clot complications. A few details to be aware of in planning for your surgery. We recommend that you avoid dental work for at least 3 weeks prior to or 3 months after your surgery. Take care of any outstanding dental problems prior to your surgery. When you return to your dentist postoperatively, please have them prescribe either amoxicillin 2 grams or clindamycin 300 milligrams and take 1 hour prior to cleanings or procedures for the first year after your surgery to prevent joint infection. If you have immune compromise or significant medical problems like diabetes or other immune compromising conditions, you may choose to pre-medicate with antibiotics for life when you get dental work done. You will get pre-testing labs, usually through the clinic, prior to surgery to screen for medical problems affecting surgery or anesthesia. If you see a heart doctor, please let us know, as we will need to facilitate cardiac clearance prior to surgery for anesthesia purposes. Surgery staff will typically have you wash with chlorhexidine the morning of and potentially the night before surgery to reduce skin bacteria and lower the risk of infection. Nutrition is also very important to consider to give your body the optimal tools to support immune health and wound healing. Drink plenty of fluids the day before surgery and also in recovery to maintain hydration. Eat plenty of protein from fresh food sources such as eggs, lean meats, fish, tofu, nuts, seeds, beans, and dairy. To avoid constipation, stay hydrated, drinking plenty of prune juice, coconut water, as well as if you haven't had a bowel movement in at least 2 or 3 days or at least passed gas after surgery, consider over-the-counter milk and magnesia or other products from your local pharmacy to get your bowels moving. Pain is quite variable throughout the time frame of recovery and also from person to person. Although we provide a variety of medications to help you with pain, you will still likely experience relatively high levels of pain the first 1 to 2 weeks after surgery, and our goal is simply to take the edge off it to make it tolerable and make you more comfortable. From an activity standpoint, there are no specific restrictions after your surgery other than to avoid long-distance running or impact, just common sense, and avoid extreme rotations of the knee for the first 3 months. Progressive activity is gradually is tolerated. Long term, most patients can return not only to normal daily activities, but even recreational sports within moderation. Running for several miles a day up to several times a week is permissible, but I would encourage low-impact exercises like cycling as much as possible. Thank you so much for your time and attention to this video, and I wish you success in your recovery from your knee replacement surgery.